to NESHA Talks. This is a platform where we talk everything medical, not only just you and I, but with the expert himself. That's none other than Dr. Nelson Makemba. So Doc, thank you always for joining us. It's November month.
Yes, indeed, and I'm excited to be here, and I'm looking forward to another dynamic conversation.
Yeah, so we always have different topics based on needs, based on the talks on the streets as well, and just to educate the public. So today's discussion is geriatric care.
Yeah.
For those that have never heard about it, I think let's start with the basics. What does that mean?
Yeah, geriatric is the part of the medical fraternity that looks at the health that often relates to elderly or senior citizens. So when we're talking about geriatric care, we're talking about everything from prescribing and how you go about interacting with the senior citizens. Their needs become very unique. You'll sort of look at them in the same way you look at children, for instance. If you have to look at how we give medications and how we take care of the little ones because their bodies are still growing, care is always taken, dosages, frequency, and everything else. The same is true about the senior citizens. We don't want to give them unnecessary, overly prescribing medications or higher doses that might end up having some significant side effect on their aging organs and stuff of that nature. So their approach become a little bit unique in that way, because they have special needs compared to otherwise adults.
So with the geriatric assessment, before we get to that, what would you classify this age bracket? When does someone then have to get this kind of treatment?
If you really look at in terms of classification, we're looking at individual age, at least 60 and above.
Okay.
And strictly speaking, most of the time, the changes that really we need to be cognitive of is that they start at 65. When somebody is 65 years and older, even in terms of the medications, you need to constantly review dosages, and you look at them holistically, the environment in which they are. Do they have a caregiver that is also with them? Because sometimes they become forgetful as well. So strictly speaking, from 65 and up, but generally, from the age of 60, we ought to be cautious already.
All right. For those that are watching, I know that either you're a caregiver, caretaker, not only just for the health professionals, but what kind of assessments can one do or run in order to make sure that you give the proper care?
Yeah, a comprehensive geriatric assessment will then entails looking at the patient holistically. You're looking at their cognitive function. Are they still able to remember? Because they become forgetful as well. You look at, is there a third party involved? In other words, do they have somebody at home that cares for them, that constantly have to remind them, especially they have to take medication and so forth. You look at their ability to function. Are they wheelchair bound? Are they still able to move around by themselves? Are they bed bound? Are they having a catheter that maybe is an indwelling catheter? Do they wear nappies, for instance, or are they still able to use the bathroom themselves? All of these things then will inform, the way in which you care for them. You also look at the environment in which they are finding themselves. Are they in an old age home where they are cared for, or are they still living in their own house with either a caregiver, or are they living with one of their, older child, for instance? And then you also look at, the socioeconomic setting. What are the financial circumstances surrounding the elderly that you are working with? When you have to prescribe medications, are they in a financial position to afford what you're prescribing? And when you have to also schedule their follow-up, can their financial position allow that they follow up, according to your scheduling, or you have to space it out a little bit wider so that there's no pressure of them traveling to your clinic back and forth. All of these kind of things that you have to look at in terms of making a comprehensive assessment. And then also, their ability to understand, you when you're engaging them, to understand the condition and question that you are actually addressing. Or do they always have to come in with somebody to help understand on their behalf so that they can go help them when they leave the clinic? Yeah, so that is the whole setup in terms of, comprehensive geriatric assessment that we're talking about.
Quite a lot of factors to take into consideration, but not only that, specifically for health caregivers, there may be some challenges. And if so, Doc, what are some of them, and how can those in this industry overcome or, aid themselves better?
Yeah, the challenges that you're looking at first is the aspect of polypharmacy from a prescription point of view. When they end up getting a bit older, you want to minimize the medication. In other words, you don't want to overburden them with a whole lot of medications, and they might end up mixing up and they don't even know when and where to take. So you take out what is not necessary, you reduce the dosage wherever it's necessary, and something that you worried might have a little bit of undesirable side effect, if you can afford to take it away, you take it away, you reduce the dosage. And then also you need to now look at infrastructure in terms of, transportation, access to healthcare, either to the doctor's clinic or to the hospital. Are they able to access healthcare facilities, with minimal, difficulties, because you want them to get in there, get help, and then out they go. So those are the type of challenges then that we have to navigate, and also the economic dynamics that comes with it. Oftentimes what we try to do, we try to set ourselves up in a way that at least our clinics, hospitals, and our health centers are actually geriatrics friendly. In other words, if a patient presents to the clinic and they are senior citizens and there's a 20-year-old in the queue, I would rather, under normal circumstances, help the senior citizen first. Make sure they got the help they need, and then out they go, instead of having to subject this senior citizen in sitting in the queue the whole day. Because then, the question also might come in, have they eaten before they come to the clinic? And then you don't want to have an older person fainting on you, because if they faint because they've been sitting the whole day, that becomes another emergency on top of the whole busy clinic that you're dealing with. So those are the stuff that we have to navigate, when we are thinking about geriatric care and looking after senior citizens.
Yeah. So not only just for the healthcare professionals, but also for you observing those elderly at clinics, like you said, Doc.
Definitely. and also for the caregivers in an event where perhaps this senior citizen entirely depend on the third person. When you bring them to the clinic, notify the clinic staff to say, look, I'm not here for myself. I got this old person, they might be wheelchair bound, so that care is given to take care of that individual, and then you are seen off as early as it can be done, unless there are other pressing matters that need to be addressed. In that way that we sort of manage the space, and then these senior citizens are not subjected to being in our facilities the whole day, and then when they leave, over and above them being old and ill already, we create problems again for them. The frustrations that can sit in with them just sitting in the clinic or in the hospital the whole day.
Also, Doc, how can the healthcare professionals create the effective care plans? You mentioned the basics now, but for the multiple chronic conditions more specifically.
Yeah, it's a coordinated effort.
Yeah.
It's a multidisciplinary approach. You need general practitioners like myself. You might need the intervention of specialists. You might also need the care and the help of the pharmacist. Because then when we prescribe and when we give the medication to the senior citizens, really care need to be taken. You don't just prescribe and then off they go, because if you do not take care, you might end up causing more problem with your prescription. So the idea really is for a general practitioner, if you are caring for an elderly patient and you review them and perhaps you feel like you're not entirely too sure of one or two items on your prescription list, you can always pick up a call and call your specialist colleague and say, look, I have an Mr. X, with this condition, and he's seemingly doing well, but he's just a little bit on too many medications. I was looking at areas of removing an item or two. Then care can be taken that way. Even our pharmacist colleague, they can be very helpful, because they've worked with many scripts from many different colleagues with different level of experience and exposure. So if a pharmacist pick up a prescription and they're like, I think Makemba is biting off more than he can chew, they will call you and say, Doc, for this lady, at her age, don't you think maybe this item and that item is a bit too strong? Why don't we really look into that? And then obviously we help each other that way. At times we might also involve, the physiotherapist, because remember, this is also the time that the senior citizens are suffering from pains in all kinds of places, from ankles to knees to back. So it becomes really a multidisciplinary approach, and also depending on their unique need and condition, dietitians can be involved as well. At times, especially, when they're a bit older, sometimes depression can kick in, or you might think of a psychological intervention as well. So a psychologist might also be involved. So you're looking at a multidisciplinary approach from the primary care level where we sit at, all the way throughout, the chain of, command, where you can, integrate and, sort of consult other colleagues in managing and delivering the best care for this kind of individuals. Yeah.
You mentioned a lot, Doc. At the introduction, you said that it's almost like giving care to a newborn. And like they say, it takes a village to take care and bring up for all those experts as well.
Yeah.
Seems like you need so many role players.
Yeah, there's a lot of role players, and even, if you look at, for instance, the people that are in foster home, if I may, or old age home, for instance, at least here in our setting in the cities, we have the benefit of, we might have a nurse that is attached to a facility, and that's what most of this old age home does. When they set up the facility, they have a nurse who is there, who might be responsible for helping these senior citizens in taking their medications. So they will have those, boxes where maybe they put in
Monday, dates, Tuesday, Wednesday, Thursday until Sunday.
Yeah, and then the meds are already sorted out.
Prepackaged,
to say, look, it's prepackaged. You just open up, and then this is what you take in the morning, this is what you take in the evening. So it makes it a little bit easy.
Yeah.
But then still, that probably works well for a functional adult. Once they develop problems like dementia, where they cannot remember anymore. So you might arrange the medications, but you have to tuck it away, and then you come and give them physically yourself. Because if you leave it to them, you might come there the next day, and then the person have taken the whole thing without realizing what they are doing, and that can become a problem as well. Yeah. So those are the kind of nitty-gritties that goes into managing individuals, at this level and at this age.
Doc, we're sitting here, but we're reaching that age to 60. Any final remarks?
Yeah. In conclusion, really, if one finds themselves caring for a senior citizen or an elderly individual, it has its own unique challenges, but it also has its own, fulfillment where that you are caring for somebody. The idea really is, if you're caring for somebody, particularly the frails, the vulnerables, and maybe they are on all kinds of medications, and you don't always understand what to do, the best is to go with this senior citizen, especially when they go for their follow-ups.
Yeah.
Sit in with them on that consultation. Let the doctor explain to you what they are also giving to the person you are caring for, so that when you leave that consultation, you own up to that prescription as though it was given to you. And then in that way, you will be able to care better for your senior citizens, be it when they are living with you at home, or even in the, these, institutions like old age homes.
Doc, thank you so much for always sharing your wealth of information.
It's always a pleasure, engaging the community and talking about this kind of topics, and I'm always excited to be doing this.
So there you have it. Please feel free to drop a comment, share this with those that you feel it's very important to reach them, especially those that take care of the elderly. Share, subscribe, like, and join us for the next edition. Thank you.